Dr. Shiva, what do you think about alternative medicine?
Why do you ask that?
Because I've had tendonitis in my elbow since probably 2017. I went and saw a doctor, and I've been doing a lot of my research.
A medical doctor?
Medical doctor, yeah.
MD. Yeah.
Yep. On holistic, what you preach. And I ran turmeric behind him. I saw,
Turmeric.
Turmeric.
The herb.
Yep. One of the strongest herbs on the planet, and shut it down quick. Told me, that stuff's okay, but I would definitely double up on the ibuprofen. That pissed me off because this lady's making triple what I'm making. To tell me that, you know what I mean? Come on.
Well, so let me tell you my position on alternative medicine. I was very fortunate, and in retrospect, it was almost a big blessing. I grew up in two worlds. Mm-hmm. I grew up as an early child in India, in a small village where my grandmother practiced one of the oldest systems of medicine called Siddha. Mm-hmm. In northern India, it was called Ayurveda. So she could look at your face, she could predict your state of your organs, and then she would figure out combinations of herbs or massage or a whole variety of things, which in the Western world people wouldn't understand. Yeah. But it had a whole system. So I was very curious as a kid how she did that. That's what got me interested in medicine. So when I came to the United States, I always wanted to be a medical doctor. Yeah. And I was a full-time medical researcher at a medical school studying why babies were dying in their sleep when I was 14. Yeah. A research fellow when I was 14, okay? But then I came to MIT, still interested in medicine, and I realized that Western medicine is excellent for a crisis situation. Yeah. God forbid something happens to your arm and you get in an accident. Yeah. Because it's wartime medicine. Western medicine came from war to put the soldier back on the field.
Not the first resort.
Yeah, but it was good for that. If something horrible happened, they knew how to do surgery, antibiotics, excellent for that. But that's at the later stage of a disease. But Western medicine knows nothing about prevention. Eastern medicine does. So I'm saying both have their position. Now the MD, the typical MD that's trained, they don't even take a nutrition course. They don't have to.
They have no idea.
So they don't even study the body as a system. Yeah. It's big pharma medicine, okay? Now surgeons are excellent, I believe, something God forbid happens. Yeah. But the typical family practitioner MD, well-meaning people, but they're getting screwed by the medical education system. Yeah. And then they have to join these medical boards and they're slaves. So when she told you that, by the way, doctors don't even have time to study or research anymore. So what I believe needs to happen from a policy standpoint, we spent so little, a fraction, like 2% of the entire health research budget on alternative medicine. I think we should at least increase that to 25%. At least 25.
I'd say even more.
So I'm talking about it, but 20x increase. Yeah. That's what we need to do, because this will be a way to crush big pharma. This will be a way to incentivize scientists to do research. And that's what we need to do. And we need to recognize, when you take ibuprofen and turmeric, I have done videos on these, ibuprofen just goes and hits the inflammatory process is a very complex system. Ibuprofen is what's called a COX-2 inhibitor. It only hits that, but it causes side effects. Now an herb like turmeric hits multiple mechanisms of inflammation. And as you incorporate it into your diet, you reduce inflammation. Ibuprofen's good. God forbid something horrible happened, you have a massive pain, right? And you don't have time to go eat. But what I'm trying to say, the ideal model is to have a low, have an anti-inflammatory diet. And turmeric is phenomenal for that. Anyway, I'm a big proponent of alternative medicine as prevention, and you use the Western medicine in the crisis situation. Yep. I hope that answers your question.
Thank you very much.
Thank you.
I appreciate it.
Okay, be well.
Vote for Dr. Shiva Ayyadurai on September 1st.